Thank you for having me. So my name is Roshni. I'm a commercial functional lead at Radventure. I'm going to talk today about strengthening cancer screening programs through integrated data management, but from a clinical perspective. I used to work in a lung cancer screening program in London, and as part of that, we implemented Nelson Plus, which is a data management solution. So I had the pleasure to transition from using spreadsheets and all sorts of hospital systems to having all our data within one system. So there's been a lot of talk today about cancer screening programs. Research shows how important these are. So organized population-based screening programs are much more cost-effective than opportunistic approaches. Or we can see how cancer cases have increased by 30% in Europe since 2000. Or if we look at the Nelson study, we can see how low-dose CT screening for high-risk individuals saves lives because lung cancer are detected at much earlier stages, and therefore the survival rate is higher. So all of this shows that it is really important to set up screening programs and invest in them. However, there's many challenges to do this. So one of the challenges is the amount of data that gets generated throughout the screening program. So all the way from invitations, assessments, appointments, images, reports, results, follow-ups, all of that is data that gets generated within the program. And quite often this is very fragmented, it's stored in different systems, EPR, radiology systems, spreadsheets. This also becomes an administrative burden because quite often there's people who have to go through that data and put it together in spreadsheets and update it. So basically one of the major risks by doing this is that participants could fall through the pathway. So delaying a follow-up or even missing a follow-up could result into a delayed diagnosis or even missing a diagnosis. And by doing that, because you rely on people updating spreadsheets, for instance, there's no real-time oversight of that cohort of participants. So to mitigate all these risks, because ultimately that's patient risk, the screening management platforms can really help mitigate these risks. So by having an end-to-end screening pathway management system, you can track participants from beginning to end, so all the way from the invitation to the outcome. It's also scalable because usually when pilots start, they start with a small cohort of participants. At that point, it's kind of manageable to record all your data in spreadsheets. But when you start trying to catch more population, it becomes unmanageable. And therefore, the system can have warnings for when you miss follow-ups, when you breach, so for instance, according to the British protocol, CT scans must be reported within 72 hours of the images being taken. And it could be for whatever the reason that the CT scan report hasn't come through the system, in which case the system can alert you, obviously based on configuration. And because all the data is updated automatically in the system without needing somebody to input data or copy and paste from different systems, it gives you a real-time dashboard with like clinical oversight on what's happening within your cohort of patients. And also because all the data is structured in the system, this facilitates auditing and Q&A. So from a clinical perspective, utilizing a structured data management system has a clinical impact, is much safer. It also enables standardized workflows, and this reduces variability in clinical decision making. It also enables real-time tracking, and this really helps losing follow-ups, missing appointments. It helps track DNAs as well. And again, because the data is structured, it can also be used for research purposes. And ultimately, because medicine is continuously changing, it just helps improve it. So just to finalize, as conclusions, 2 messages here. One of it is that without an integrated data infrastructure, screening programs cannot be delivered safely at scale. And the data is not a support function, it's the backbone of clinical safety in a screening program. Thank you.